cholesterol, you may think something negative, but there's actually a bad type of cholesterol and a good type. Dr. Michael Ledet from Springhill Medical Center tells you about the different types and talks about ways to keep your body healthy. This morning we're at the Daphne office of Springhill Medical Center and we are talking cholesterol with Dr. Ledet. Thank you for having us over.
Happy to.
Okay, so you see all of these advertisements, commercials, lower your cholesterol, this and that. But where do you begin? How would you go about knowing if you have high cholesterol in the first place?
First off, the only way you know if you have high cholesterol is getting your blood test done. Okay. There are some skin lesions we see sometimes associated with cholesterol, but basically you need a simple blood test done. And cholesterol is not the only thing that's related to heart disease. When I look at someone's cholesterol profile, I look at the risk factors for cholesterol, for risk factors for heart disease, which would be premature family history, father under age 55, a mother under age 65 with heart disease, diabetes, high blood pressure, and smoking. Those are things that really increase your risk for heart disease.
Okay, talk a little bit about treatment. What can you do to prevent high cholesterol or to get your cholesterol lowered?
You know, I always talk to my patient about the triple E's, Ledet triple E's, proper eating, okay? The DASH diet has been the only diet that I'm aware of that's shown to decrease stroke, heart attack, and heart failure. It's a Mediterranean style diet.
Okay.
The second E is proper exercise. The Heritage trial told us that if we exercise 150 minutes a week, we can improve our health status, particularly improve our good cholesterol. And the third E is quit making excuses.
And let's talk about that. There are a couple of types of cholesterol. You just mentioned good and bad. What are the differences?
Well, you know, the two types of bad cholesterol, the LDL cholesterol, and L is low density or should be low. Your bad cholesterol is mainly made up, it comes to us in diet by saturated fats and cholesterol. So you should keep your saturated fats less than 7%, your total cholesterol content less than 300 milligrams a day.
Now, if you do visit your doctor and your doctor says you have high cholesterol, are there medications that can treat that? Yeah.
First, high cholesterol in itself is not the important point, because a lot of women have high good cholesterols, which makes their total cholesterol high. So that's not necessarily a risk factor. So I don't use a total cholesterol as a judgment to treat patients. So I look at the LDL cholesterol, which is a bad cholesterol, should be low. Triglycerides are another form of fats that cause heart disease, and triglycerides come from high carbs.
Okay.
You know, I always tell my patients, beer, bread, pasta, potatoes, and rice. That's where all your bad carbs come from. And then your HDL cholesterol, which should be high, is your good guy. It's sort of your garbage truck. It goes around and picks up cholesterol in the bad places and gets rid of it. That's increased by not smoking and exercising primarily.
Now, what actually causes a heart attack or a stroke?
The most common cause is a plaque made up of a lot of cholesterol ester inside the arterial wall, and it ruptures. We think that a plaque just builds from 10, 20, 30, 90%, and then 100% becomes a heart attack. That's not true. That's why you have these people that have stress tests and get a cardiac evaluation and be normal, and then 6 months later they die of a heart attack. Because the plaque in the arteries can only be 20 or 30%. It ruptures from, and it causes what I call the volcano. It causes a blood clot, which then causes a stroke and the heart attack. So it's not just continued built-up of plaque, but it's the plaque that gets what we call now unstable. Most common cause of unstable plaques is cigarette smoking.
So to make sure that you stay away from those things, stay away from cigarettes, stay away from the other things that you mentioned that are bad for you, and make sure that you get plenty of exercise and eat right.
That's right. Exactly right. Exactly right.
And of course, visit your doctor regularly to make sure that everything is on the right level, right?
Get your cholesterol checked.
Get it checked. Thank you so much for having us over.
Thank you.